Hello. Hi, everyone. Welcome to Shae's Warriors Talk, Listen, Share, our educational program that runs every second and fourth Wednesday of the month from 5:30 to 6:30 Pacific time. So today we have a extra special program with some special guests that will be introduced later. Let me go through what Shae's Warriors is all about. Okay, so everyone, welcome to Shae's Warriors. We are a 501c3 nonprofit with a all-volunteer board of directors that was formed in the Coachella Valley to help our cancer community thrive after treatment is over. The mission of Shae's Warriors is to inspire, inform, and empower through health, fitness, and the mind-body connection to heal survivors and their families through a national network of support. Our Talk, Listen, Share community was formed as part of our online educational outreach to support each other through survivorship and thrivership. Talk, Listen, Share is hosted by our board members, Shae Moraga, the founder of Shae's Warriors, and myself, Dr. Sonia Fung. I am a naturopathic doctor specializing in integrative cancer care. And today we are having two special guests. They are oncology nurses from a business called Perky. And we are going to talk about 3D, 4D nipple tattooing. And I would like to introduce them right now. So here we go. Welcome.
Hi.
Hi, thank you.
Can we take over now?
Yes, please take over now.
Okay, so I'm Crystal and this is my partner Courtney, and we are the founders of Perky. Perky is the new art of healing for breast cancer survivors. Like Sonia mentioned, we're both registered nurses and we specialize in medical micropigmentation. So a lot of people don't know what micropigmentation is, but it's a form of tattooing and we specifically cater our skill set to the breast cancer community. We launched in June of this year, but we started planning a few months prior during the COVID pandemic. We just had a complete change of heart. We wanted to help this community in a different way, in our own way. And we wanted to create a space that women could enter and leave feeling more confident, higher quality of life after having a Perky experience. So today our main topic will be 3D and 4D nipple tattooing options. And I'll let Courtney chat about 3D options with you.
Yeah, so we're located in San Antonio, Texas. And like Crystal mentioned, we used to work with breast reconstruction patients, and we had done a lot of 3D tattooing and 4D tattooing there. So what that entails is using, a 3D tattoo is completely flat. So the skin from the breast is flat. There's no reconstructed nipple bud. Sometimes you're not a candidate for nipple reconstruction, or you don't want to have nipple reconstruction. Some women don't want to go through an additional surgery or have more scarring there. So they choose to have the nipple tattoo created with the illusion of protrusion. So that's what a 3D nipple tattoo is. Front on, it looks like it's projected. From the side, it's completely flat. But it can be a really beautiful option for women who don't want to go through another surgery and want to just skip right to the tattoo process.
Yeah.
So with our 3D technique, we do the first session about 3 months after your latest surgery, but that is really dependent on what your surgeon dictates is appropriate. So we want to make sure that you've healed from your latest surgery. If you've had fat grafting, you have some swelling, that all of that has subsided so that things look even. If we're doing one side, we like to match it to the native side. So we use that as our template for the side that we'll be tattooing. And if it's a bilateral, both breasts, you get to pick and choose everything. So that's where you can pick size, location, color, all of that fun stuff. And then you always get to pick the detail work.
So what are common scenarios when women don't undergo nipple reconstruction. So like implant-based
Mhm.
breast reconstruction. So a lot of times if you've had implant-based reconstruction, you don't have enough skin to do a surgical nipple reconstruction. The skin is too thin, the skin envelope. So in those scenarios, 3D tattooing is a great option. Another thing you mentioned was if there's too much scar tissue there.
Mhm. Yeah, sometimes if you've had radiation, the quality of the skin there isn't appropriate for the surgeon to come in and make those additional cuts and create the nipple bud.
Even someone who decided like aesthetic flat closure, you know, so you just have like your transverse scar, we could do a small 3D nipple tattoo there for you as well.
And with the 3D tattooing, there's a lot of customizable options. So we have a few examples to show you from skins that we had worked on. So we have a nipple bud that looks a lot more clean and there isn't a whole lot of detail work. That's kind of one of our more simple techniques. And then you can range to, you know, an inverted nipple bud with more detail work, a little more fun and flair there with Montgomery glands, the little dots and wrinkles. And this is an inverted nipple in case, you know, the other side is inverted, or if you previously had inverted buds and you want to recreate that. So some women come in with like pictures from before surgery and they want to emulate what they had previously. And some women just want to start with a clean slate and design it themselves.
Yep. And then 4D nipple tattooing options. That's when a woman has undergone a surgical procedure or an office procedure for nipple reconstruction where the surgeon utilizes either a prosthetic or her own skin to recreate a protruding nipple bud. Sometimes they heal larger than desired. Sometimes they heal and they're very flattened. But either way, we could do a 3D tattoo approach to that. So basically, we would be adding tattooed ink and like the appearance of an areola to enhance upon the nipple reconstruction. So it's pretty much the same technique as a 3D, maybe a little different. But you know that all that color and detail work is to enhance upon the nipple reconstruction that you had. Did I miss anything with that?
I don't think so.
Yeah, so that's, yeah. And usually, so if you've had nipple reconstruction, usually we wait at least 6 weeks to 3 months after you've healed from that procedure before you can undergo the 4D nipple tattooing. So our procedures, what's the Perky experience here? So we consult for free. Here we give complimentary consultations here at Perky, and we can do virtual or in person. We would go over your medical history, and then we would determine what are your goals with your nipple tattoo. So if we're doing one side, it'll take about an hour and a half. If we're doing two sides, it may take like 2.5 hours. We always numb you, so do not worry about discomfort.
And a lot of times there is less sensation to the breast, especially if you have like a skin island from a deep flap or right around the scar, there's less sensation there. So it's usually not a painful experience, but we always use number just in case to make sure that you're not feeling any of those sharp pinpricks of pain.
Yeah, we do want this to be a pleasant experience for you and not traumatizing. So we really set the ambiance for you. We'll have essential oils, we'll play music, numbing cream is always helpful. And we always chat. It always ends up being like a little therapeutic session too. So you'll get a free therapy sesh with your nipple tattoo. But I think it's a really one of the more fun aspects of your journey naturally. And it's a nice cherry on top to finish your reconstructive journey, to undergo nipple tattooing and kind of hopefully be able to have some sense of closure.
And this is also the part of it that you have a little bit more control in. You can help us pick the size, the location, the color. We always use the ink line we use is specifically made for areola. So it's a very wide range. We should have grabbed it to show, but it has a wide range of colors. Beautiful, ranging from like lighter pink all the way to pinky brown to brown. So we have a lot of options for mixing and matching. So you really get to customize that color and pick that detail work that will fit for you.
So some women have had, nipple reconstruction, or they need nipple tattoo on one side, but perhaps they have scarring on the other breast. Or you were nipple sparing and you're able to keep both of your nipples with your reconstruction and mastectomy, but you have scarring around the areola. There's areola work that we can do, whether it be areola scar camouflage or more of just like a generic scar camouflage to improve upon the appearance of your scarring. Usually, most of the time, one of the main techniques that we would go towards is areola kind of extension. So if you have, it's very common to have like a lollipop scar around the areola. So you have that and then a vertical one going down. So that circular scar around the areola, we could extend your areola color out to kind of blend that scar into the areola. And then we can always do scar camouflage to any breast scars using flesh tones. So I think those options aren't usually offered to women. So I really wanted to mention that, native areola work with tattooing can be done, and also breast scar camouflage as well.
And the scars, we usually wait a little bit longer, 3 to 6 months, depending on how it's healing, before we will tattoo that particular scar with camouflage, just as a side note. Mm-hmm. And with nipple tattooing, that is part of your breast reconstruction. So that should go through your insurance for them to cover that. So for us, we, as nurses, we know those codes for the insurance companies. We're currently working with an attorney to get on with particular insurances here in Texas. So we're waiting for that process, a little bit of a lengthy process. So we can accept a few carriers. And what we do in the meantime, we have the ladies pay out of pocket, and then we help fill out everything for reimbursement. So there are forms that you need. We have a little checklist that we can guide you through. We always provide the letter of medical necessity, itemized receipt, and give you pretty much everything you need to mail it off to your insurance company to get that reimbursement.
And I think that's super important and super helpful, because if you go to a typical tattoo artist, they're not going to know what codes to submit, or, they're not going to take the time to find what reimbursement form to fill out for you. I think it's very streamlined. It's very helpful. And we just our goal was to make this, as streamlined of a experience for you. So that's why we offer that. What else? So nipple tattooing, it's super important. And I think a lot of times doctors, maybe some of your surgeons, kind of belittle the importance of a nipple tattoo. A lot of doctors' offices offer nipple tattoos, but they're not top quality. So then the woman gets, a really low grade tattoo that's faded. It's very patchy. Maybe it caused a lot of scar tissue. And then the woman wasn't able to get the closure that she so strongly desired. At Perky, we strive to give the best optimal 3D, 4D nipple areola tattoos so that you can go on to your next chapter confident and happy, and hopefully with some closure. So definitely research whoever you go to, whether it's Perky or another nurse or a tattoo artist. Look at their before and afters, know what you're getting into, be sure that you're going to have a say-so in it. I think it's really fun that you're able to choose colors and size and positioning with us. It's your body, so you should be in control.
Yes, and we will give you recommendations if we feel the color isn't appropriate for your skin tone. A lot of times we steer away from colors that will kind of turn more orange with time. But it's been a little surprising since we've been open. A lot of what we've gotten in from clients are those faded tattoos done elsewhere in primarily their surgeon's offices.
Yeah.
And it's a very old technique. The coverage is really terrible and the colors are just not updated.
Yeah.
So there's such a better way to do it. It doesn't have to be this, lackluster, monochromatic, right? That's the number one word people have used to describe them, because they truly are just one tone in a really odd color. So that's what we really always try to pick colors, and we try on We try them on your skin right where it's going to be so that we can make sure that it's not going to turn orange. And a fail safe that we always have is the touch up. So 6 weeks after your first tattoo, once you've healed fully, we take a look at that color. Did we miss the color tone? Does it need to be a little bit darker? Does it need to be a little bit, tweaked as far as that tone? And then are there any patchy areas that we need to fill in? Do we need to enhance the detail work? So we really want to give you a longer lasting tattoo that isn't going to be monochromatic and fade within a year of you having that tattoo.
Right. Now, with that said, all tattoos fade with time. Everyone's skin chemistry with the inks is a little different, but on average, we tell patients that after touch-up, their nipple tattoo should last them 5+ years. But again, everyone's different. There's some people when we're tattooing them, their skin is just like so welcoming to the pigment, like they just absorb the ink so well and it's very smooth. And some people have a little maybe thicker skin, or if there's more scar tissue to work with, maybe their tattoo may fade a little quicker just because of the skin integrity. So that's another factor to take into account. But as we mentioned, scar camouflage earlier on breast scars, we can kind of go further into that. So as Courtney, I think she mentioned, with scar camouflage, we have to wait until that scar is matured and ready to take pigment. So typically we wait like
3 to 6 months.
Mm-hmm. Like 3 to 6 months, depending on what the scar looks like. And then we can start. First, we always do like a color test. So we'll choose different colors with you, and on a very small aspect of your scar, we'll implant some ink. You'll come back a week or so later, 2 weeks, to see how that actually settled within the scar, if it's the right tone. All of us have different colored undertones that we have to be mindful of. Some people pick up colors more yellowy, more orangey. So we're just, making sure that we're not going to full-blown do your scar camo and then it heals undesirable. So you'll do the scar test, the color test first, come back a few weeks later. As long as we're happy with that color, then we'll proceed with doing the full scar camo on any type of breast scar. Now, I take that back. So we can do hypopigmented scarring.
You read my mind.
we can. So if you have a scar that's hypopigmented, that means it's white. It's lacking color. So we can add flesh tone to those. Pretty easy peasy. There's hyperpigmented scars, and that's when they're a little darker, maybe a little more, brown or pink. Most of the time, adding a lighter flesh tone will do the job. Now, if you have like a keloid, a super raised scar, then scar camouflage is not going to be suitable for you. So most scars we can work with, but keloids or super hypertrophic scars where they're really raised, that may need more of like a surgical intervention or laser with your surgeon.
And since we're touching on scars, there are some scars that aren't immediately a candidate for camouflage. Mm-hmm. So one of the things that we look at is that a raised, more red scar? Because if that's the case, we would offer something called scar needling first. And what we do is use a serum. We use a nice hydrating serum with the needle, and we just kind of go over that needle the same way we would in a camouflage using a pigment, but there's no pigment. It's just the serum. And that really helps with that tissue, bring more collagen, and it can flatten it and actually take out some of that redness and kind of bring a better tone to that scar. So sometimes we do that before camouflage if we feel like that's the best route to go.
Right, yeah, and that'll just optimize your long-term results of the pigment uptake. And then scar camouflage as well will require maybe 2 sessions, maybe up to 3, but it's all included in your first initial fee, any touch-ups. And we do numb for those as well. Another service that we offer is radiation marker camouflage. And those are typically very close to well, naturally, they're very close to the breast, around the perimeter of the breast. And those are little blue dots. And those can be easily neutralized to look at like a freckle or a beauty mark. So a lot of times when we're in there doing a 3D or a 4D nipple tattoo, we can go in and add a little bit of warmth to those blue dotted radiation markers, and we can, improve upon the appearance of that while you're getting your nipple tattooing done.
Yeah. So when we thought of Perky, our experience was primarily with the nipple tattoos, but we had all of this experience chatting with ladies about life after cancer and what is really bothersome for them. So when we created Perky, we thought of services that could really cater to what someone post chemotherapy, post radiation, post reconstruction, or lumpectomy, any type of surgery to treat their cancer. We wanted to be able to offer something that could help if they wanted it. So some people love their scars and want to rock them, and that is a sign of what they've been through. And some women do not want to see them. So that's why we offer it. It is a service that we can provide, but we don't, it's not something you have to do.
It's definitely a personal choice.
Right. And the primary thing that we've heard in regards to the nipple tattoos is that we've had a few women come in that waited a number of years after their surgery to get it done because they had reservations about completing the tattoo. They've been through enough. They didn't want to spend more time in an office.
Or they didn't think it was important to them.
Right. And, I think what we've heard is that they didn't realize the impact it was going to have and that it made them truly feel whole again. And that is 100% what we're here for.
Absolutely.
We just want to give back what somebody feels that they are lacking and need.
Mm-hmm. It can help you regain your femininity and to feel complete. That's another word we've heard, complete, whole again. And like you mentioned, that's exactly what we're here for. I think the impact of a nipple tattoo on anyone affected by breast cancer is really, really important to not belittle.
So we have a few questions. Do we do any traditional tattooing? We are dabbling in some smaller, more line and shading techniques. We do have a client that will be coming in a few months for flowers. So we've been practicing giving her a couple options. So she's kind of chosen what she wants. So we can do smaller things like that. But if you want a really intricate, beautiful tattoo to cover up something or in place of a nipple tattoo, those we would refer to a tattoo artist that does those regularly. So we're not trying to go out of our bounds, but if we can do a cute little flower with some lining and shading in our areola tones, we are all for it.
So that lady will be getting flowered areolas.
Mm-hmm.
Yeah.
And then my doctor told me never to cover up my radiation tattoos in case we need to use them again. It's my understanding that once you've undergone radiation to a particular area, you're usually not a candidate for radiation again, depending on the amount of treatment you've had and the location. So I'm not familiar with that being the case, but it's also those markers are still there. They're just not blue anymore. Mm-hmm. So they're not being covered up by a large tattoo. We go in and dot the existing tattoo. And we do have photos of this on our Instagram. We have a lot of before and afters. And one of the things we do have is the radiation markers. So on Instagram, we are Perky. So you can always go there and take a look. But they're still in their exact locations and they're present. We don't do anything to them except for neutralize them, which just means injecting a warm tone to it, turning it from a blue to a brown.
Mm-hmm. But you should always listen to your doctor, even with nipple tattoos, if they don't think you're ready yet. So that can be something we chat about really quick is for women post breast reconstruction, what are factors that can delay them from having their nipple tattooing? So if you've had implant-based reconstruction, say it's been 3 months and on paper, you should be able to do your nipple tattoos. But if your surgeon feels like your implants are still settling or there's still some swelling from your fat grafting, then we need to, listen to your surgeon, let your implant settle, let the inflammation subside before we proceed with the tattooing. And that'll just optimize your long-term results, because what will happen is if you do your tattoos too soon, then once everything has settled, your nipple tattoos will not be symmetric. You know, if one implant has kind of dropped and rounded out, then one nipple has dropped too. So then definitely that wouldn't be ideal. So that's why we definitely have to take into account what doctors have said. If you've had autologous reconstruction,
which just means using your own tissue, usually tummy tissue or back muscle and fat.
Usually the 3-month marker is kosher and there shouldn't be any issues with you proceeding at that point. But when you throw factors like radiation in the mix, you know, we may have to wait. If your skin integrity has not fully healed over, you know, we may have to wait 4, 5, 6 months.
And our goal is to be very complimentary with the plastic surgeon.
Yeah.
So we definitely defer to them, and we want to improve their results and enhance their results, not make anything worse. And to touch on, if you do heal with a little bit of asymmetry, usually people are not perfectly symmetric. So if you do have a small amount of asymmetry, we can kind of, and you had nipple reconstruction or not, we can kind of play with where your nipples fall to help your eyes draw more symmetric and not notice that asymmetry as much.
Mm-hmm.
And also a great point, now that I'm touching on that, about the nipple tattoos. If you do have scarring to the breast that you don't want to camouflage, a lot of times the nipple tattoos can be placed in a way that can kind of draw your eyes away from that scarring.
Totally.
So it really helps kind of balance the breast and draw your attention there as the focal point instead of the scarring.
Mm-hmm. Mm-hmm.
Check here.
Any other questions? Yeah, I see.
Oh, there we go. Perfect.
Oh, yeah, she added it. Yeah, on our Instagram page, we show a lot of before and afters of 3D results and 4D nipples. Courtney mentioned the radiation marker. I think we're about to put some scar camo on there, but we also do eyebrows. And when we were planning our services, we chose eyebrow micropigmentation for women who were planning on undergoing chemotherapy or who have already undergone chemotherapy. So we're trying to figure out different treatments that you've undergone and how we could help you with our services. So definitely, if you find out you've been diagnosed with breast cancer, the doctor tells you you're going to need chemo. One of the main things people are worried about is, oh no, I'm going to lose my hair and people are going to know that I'm sick. And a lot of times we don't realize that does also mean your eyelashes, your eyebrows, your hair, head to toe. So if you are, if you do realize that you're going to need chemo, you could chat with your doctor to see if that's something you could pursue. Eyebrow micropigmentation is something you could pursue before treatments. If not, once you've healed, once they give you the clearance, we can help you with that post chemo.
And a lot of the women we've had for eyebrows are a few years post chemotherapy, and their eyebrow hair didn't grow back the same as it was prior to treatment. So they had kind of lacking areas, patches that were missing hair. Sometimes it grew back in a different shape. So those are things that we can correct even years after treatment if that's something you need. Sometimes they grow back in beautifully and sometimes they don't. So that's just something that we offer. Yeah,
I'm so grateful. Oh, how long does it usually take to get 3D versus 4D?
So the technique is exactly the same. The unilateral takes about maybe an hour and a half or so. And if we're doing both sides, it can be 2 to 2.5 hours. And that does include the time we spend placing, drawing it on, making sure you're comfortable.
Picking colors.
Yeah, location, size, colors, all that. So it's not whether we're doing 3D or 4D. Those techniques are the same. It's just whether we're doing one side or both sides.
Mm-hmm. And then aftercare is a great topic. So once we're done with the procedure, we will go over aftercare with you. We'll always send you home with a sheet of instructions just in case if you completely forget what I told you. But basically we utilize Aquaphor or Vaseline some type of,
Petroleum jelly based
yeah.
moisturizer.
Yeah, we really like Aquaphor.
Mhm.
But you'll just put a light coat over the tattoo and then like a non-adherent, non-stick gauze over it. And you can kind of replace that once daily for a week.
And one thing with the process, you will get a small amount of pinpoint bleeding with the tattooing, like you normally do with any type of tattoo. But you should not be heavily bleeding. Once you leave there, if you get that tattoo and you're heavily bleeding, you're probably going to lose a lot of that color. And we know that, unfortunately, from experience, from using an older technique where you did bleed more. And what we notice now with the way we do the technique in a little bit more of a gentle fashion, you retain more color and it's more longer lasting. But whenever you leave, it's a really easy aftercare. You're really just applying the moisturizer to make sure it doesn't scab too heavily and pull off the color. And you do that, you'll notice some mild oozing for the first 24 hours and then usually very, very mild peeling.
Mm-hmm. And then some people, maybe for the second week 2, they'll continue to put a little bit of Aquaphor here and there.
Just if it's a little dry. Yeah.
But definitely we're trying to prevent scabbing because we don't want the ink to fall. And
that aftercare really applies to pretty much everything we do. With all of our procedures, we use a really cute little pink tattoo pen, and we have a variety of different needle types that fit that pen. So we're using a lot of similar techniques on everything we do. So the aftercare is pretty much the same, moisturizing it for about a week or so. So that goes for eyebrows, the scar camouflage, and the radiation markers, as well as the nipples.
Mm-hmm. And then when we are planning the nipple, I know Courtney kind of mentioned previously on different nipple bud characteristics, but also within the areola, there's different areola work we can or we don't have to do. So like this one here has little Montgomery glands. I don't know if you can see them. There we go. Those little dots. And those are very, typically on a native areola. They're called Montgomery glands. And there's also little ripples. You can see some kind of ripple work in there. So we can, do a lot of that. We have some that are a little more cleaner that don't have, like this one. This one here is more of just a clean areola that doesn't have a lot of extra detail work on it. Sometimes that's what we have to do when we're matching, if we're only doing a unilateral tattoo. But we do always do shading, highlighting, and then some form of detail work, whether that be rippling or Montgomery glands, just to give it a more realistic appearance.
And that same thing goes even if you have the surgically reconstructed nipple bud. We do all that detail work on the bud as well, just to enhance it. And sometimes the buds don't heal perfectly even. Sometimes one will be a little bit larger or a little bit more flat. So we can kind of play with the coloring on those to match them a little better. And then as far as Crystal mentioned, when you consult, we get your medical history. And what we're primarily looking at, are you medically cleared? Are you okay to have this procedure? It is minimally invasive, but we still want to make sure it's safe for you. So we always go over your medications with you. And we want to make sure you're not on things like blood thinners. If you're taking a baby aspirin for heart health, we would want you to stop that a couple of days before and after the procedure. Things like fish oil, very common supplement that most people take, we would want you to stop that because it can thin your blood. So we want to reduce any bleeding that you may have just to help with color retention, to make sure it's nice and safe. But if you are on a medication like a blood thinner that you have to be on for something like a blood clot or some sort of irregular heart rhythm, we would check with your doctors and get a plan from them. So we would check in with your surgeon, your cardiologist, and make a game plan from there. So always make sure, even if you're not doing a tattoo with us, that people are doing their due diligence before you have the procedure.
So we have a question: can nipple tattooing damage my implants? And the answer to that's a great question. So when we're tattooing the breast over an implant reconstruction, we are in that top layer of skin. So we are not penetrating through the skin with our needle, and we're coming in at an angle. So we will not touch your implant whatsoever. Your implant is safe. Your implant, actually, your body creates a capsule around it. So you have that capsule. So you have implant, capsule, probably some fatty tissue,
Sometimes muscle.
sometimes muscle, and then your skin. So we are just on that very top layer of skin, so you should not have any issues to your implant.
And we'll always check how thin your skin feels there. I have done some 3Ds on very thin skin over an implant, and they did beautiful.
Yeah.
They had issues previously getting color retention, and so this technique, the type of needle we use and the fact that we can come in at an angle to the skin really helps when it's thinner skin. But we always check and make sure, but it's a very safe procedure even if you have implants.
3D nipple tattoos on implant-based reconstruction.
Beautiful.
Always look beautiful.
Always are.
Another question is, where did it go? Are nipple tattoos really permanent? And as we mentioned before, no tattoo is completely permanent. It should last you about 5+ years, but everyone's personal skin integrity is a variable factor.
And as far as lasting, you will always retain some of the pigment in your skin. It just usually has a little bit of fade. So you can, judging on how much fade you've actually had to the tattoo, you could come in for a smaller touch-up to enhance what has faded. But usually it will fade with time. And everyone's different on how much time that is.
But you can always, every few years come and get a quick little touch-up.
Mm-hmm.
Yeah. What is the cost? So at Perky, if we're doing only one nipple, we charge $400, and that includes a touch-up. And if we're doing both nipples, then we charge $600, and that includes a touch-up as well. And we always, if the patient has insurance, we fill out all the proper reimbursement forms for their submittal to hopefully get partial or complete reimbursement.
And one thing we've seen too, sometimes if you've had all of your surgeries and treatments in one particular calendar year, and then you're ready for your nipples in the next calendar year, and they charge your out-of-pocket and deductible, you can end up paying significantly more than that $400, $600. So sometimes it's actually helpful to pay out-of-pocket, but it really depends. If you've already met your insurance deductible and you're, collect zero with them, then that would be a cheaper process.
Mm-hmm. And, every so often we do offer free pro bono nipples tattooing for women in need. So our goal is for once a month to be able to offer that service. In fact, we have someone coming from out of state to get one. So we're really excited to meet her. So if you ever know of anyone or you yourself needs that service, just let us know.
And we always work with you if you need a payment plan or something like that. We're more than willing to help. We want to help and get you what you need in any way we can.
So the next question is permanent ink safe for breast cancer? So the inks that we utilize were specifically curated for areola work.
And blush tones.
So they do not have any harsh metals or heavy metals in them, and no iron oxide. So they are very safe. They're vegan.
And you can undergo MRIs with them. You would just let them know that you've had the tattoo. But we've been using this line for 3 years now, and we've had no issues. And with this, it's a little bit of a thicker, more traditional ink type. So that's why you get more retention. The prior pigments that we use there aren't actually inks. Those were more watery. So these inks are safe and they're much longer lasting.
Mm-hmm. Do we offer eyebrow micropigmentation for non-cancer patients? Absolutely.
We've had a number.
Our business model, Perky was created with the breast cancer survivor in mind, but definitely we can offer eyebrow micropigmentation options to the general population as well.
I have had my eyebrows micropigmented by Crystal.
Let's see, another one. Why doesn't all insurance cover the cost of nipple tattooing?
Insurance sure is a tricky thing we've in our experience. It depends on their contracts with certain entities. So they'll have a contract with surgeons' offices that have particular guidelines. So some things may not be covered through their specific contract, even though if you were to call them up and say, hey, do you cover this? They would tell you yes. So it's very tricky. It depends on the exact contract that you've made with them. So they should cover it and they should reimburse you. But sometimes what they do with the reimbursement is not give you 100% back, cover only a portion of it that they deemed appropriate.
Mm-hmm. But by law, all reconstructive procedures post-mastectomy, regardless of your reason of mastectomy, if you've had a mastectomy, whether it be one side or both sides, any reconstructive procedure to follow by law is required to be covered by your insurance. And that does include the final stage of nipple tattooing.
And sometimes it's that people aren't using the correct codes. So you have to, insurance companies want you to use particular codes. They want you to state certain things in order to cover it. So we fortunately know that lingo and we know what they want to hear. So that's what we put on all of our paperwork, and we put it on multiple things so that they can't say it wasn't there. So you want to make sure that they're using the correct codes, that they know the right codes, and that's CPT codes and the ICD-10 codes. And then every woman that we've had, we have said, if there's any issue, if they give you any pushback at all, please let us know. And so far we have not heard anything back.
Knock on wood.
Yeah. So we're willing to make calls and advocate and make sure that they know by law they're required to cover this. But we haven't heard of that being an issue in our area, at least, fortunately.
Mm-hmm. Let's see. So, if someone comes from out of state, how long do you need to stay to make sure everything's well before they return home? So for anyone coming, whether you're coming during your lunch break or you're coming from New York, you can go back to normal life for the most part that same day. The only restrictions that you'll have are no submerged water, no excessive sweating.
So no strenuous workouts.
Yeah, so if you're going to walk, you can maybe do that in the morning or the late evening where it's not really hot. We don't want you to be sweating a lot in your cleavage area or your breast fold and potentially put yourself at a risk of infection. We don't want you to be submerging in water because then that'll affect your dressings and the healing process.
As far as timing, though, for you coming from out of state, we want to make sure that you've been cleared by your surgeons. We kind of know our area and their protocols, but we want to make sure that the surgeon that you have in your area is comfortable with us performing the nipple tattooing at the timing that you've scheduled. So I'd say it would be great to give us at least 2 weeks notice so that we can contact your physician and make sure that you don't book travel here or plan time here and it was all for naught because your surgeon wasn't ready for you to come yet. So checking in with us maybe 2 weeks in advance so that we can get your medical history, check your medications, and then check with your surgeon and make sure that you're cleared to come.
And then post-procedure, if you are cleared, you have the procedure, you could go home that very evening, next day. Enjoy San Antonio. But yeah, what is the healing process? So again, about a week of your dressings of the ointment and the gauze, and then probably second week you'll notice a little bit of peeling, but by third week it should be minimal peeling to none, but nonetheless we do ask 1 month of no submerged water.
And with the nipples, what you'll notice, we're poking your skin with needles, so it usually is more red in color and darker in color when you leave. So we always tell you, do not hate the color and do not fall in love with the color because it's going to change. So over the first 24 hours, you'll notice some slight oozing. When you go to change your dressing, we have you do it twice a day, once in the morning, once in the evening. And dressing's a little bit of a dramatic term. You're just using a non-adherent pad so you don't get any of that aquaphor on your bra. And we tell you not to wear your, prettiest, most expensive bra because you don't want to accidentally get some of that on there. But you're just changing that twice a day and you'll notice it change over time. So the first 24, 48 hours, it's going to be darker. And then you're going to notice the color lighten as it's healing and getting into that kind of dry, peely stage. By about 3 to 4 weeks, that's when it's fully healed and you're going to see what the primary color will look like. And it may lighten a little bit further from that 3 to 4 week mark up to 6 weeks. By 6 weeks, you are fully where you're going to be for a long period of time.
You'll be coming in for your touch-up.
You're coming in for your touch-up, yeah. But if you, some women have actually chosen not to have their touch-up because they were happy with it. We always advocate for a touch-up because there's always a little something that we see that we'd love to enhance or, you know, provide just a little bit more for. But if you really don't want it, you don't have to. But it is a feel safe. And you don't have to do it at 6 weeks either. If you're traveling here and 6 weeks doesn't work out for you to come back, you could always plan it a little further out if that works for you. Can anyone touch up our
Ask any artist, any surgeon, anyone. You're gonna want to finish your own work.
So we can touch up each other's. So. Even that we don't love, but because I think we're all a bit.
We all have our own.
We love,
touches.
yeah, we love what we do, and we love doing it the way we do it. But yeah, if you absolutely wanted to have a touch up with someone in your area, you theoretically could do that. But everybody does things differently. So Crystal and I learned the same techniques. 3 different techniques actually, and we have merged those techniques in our own way. So the way that she does it is different than the way that I do it, and we can kind of you know, tap in if we need to for each other on the touch up, but it's different depending on who you go to. And if you take a look at people's results, you'll see that.
Another concern would be
Cost.
they're using different inks than
True.
you know, if you go to one artist first round and then another artist second round, they're probably using a different line of inks, a different needle, a different pen type.
And there is another very popular ink line that a lot of artists use that's very harsh tones. It is not the same kind of friendly tones that we use. And the other thought is that a lot of people are not going to touch up your tattoo for free. So then you would be paying additionally for that touch up, and nobody wants to do that.
Great point. But yeah, so I think, did we cover everything?
I think so.
If you have any more questions, always feel free to reach out to Courtney and I. We're always here for you. We absolutely love what we do. We love this community. And we just want to give everyone 3D and 4D nipple tattoos that needs.
And so it's up there to contact us, our website, www.helloperky.com. You can find us on Instagram at We Are Perky. We're also on Facebook at We Are Perky. Our phone number, 210-712-9765. That is a cell phone number, so you can text us, call us, leave us a voicemail, whatever, email us. Our email is info@helloperky.com. What else?
I think that's all of our
and we're
contact.
on the resources page.
Our socials. No, I'm just kidding.
Our social security. Yeah.
And we are on the resource page on shayswarriors.org, so you can always find us there too. But again, we just love what we do. We really want to help this community. Definitely feel free to reach out to us with any questions, concerns, guidance. We're very experienced in breast reconstruction and a lot of breast cancer treatment. So you ever just need someone to pick someone's brain about something, we're here for you. All right. Well, y'all have a good evening. And thank you so much, Shae, for having us.
Great. Shae, am I on? Okay, here we go.
Hi.
Hi. Hi, ladies. Thank you so much. This was such great information. I think that what you guys do is so important, and it's such a great asset to our breast cancer survivorship community here. And I think that I learned so much listening to you both about like the differences between 3D and 4D and the different inks and everything like that as well. Because it's obvious that you put a lot of thought into this, and I think, looking at your work on Instagram, it looks amazing. So. And I really appreciate, and I know Shae appreciates you joining us tonight and speaking about this. And we definitely want you back for more information on what you do and for other services that you also provide as well. Because
we would love that.
Yes.
Yeah, thank you so much for having us on. We appreciate the platform.
Thank you so much.
Being
We
able
love
to
Shae's
speak.
Warriors.
Yeah.
Yes.
Oh, thank you so
Yeah, you
much.
guys are really cool. We don't have as progressive of a community here in San Antonio.
We're trying.
So we love it. Yeah.
It's getting there. It's getting there.
Yeah,
So
yeah.
just to thank you again for joining. And I know there's a time difference as well, so it's pretty late for you guys. But yeah, we really appreciate your time, and we really appreciate your partnership and your support for Shae's Warriors and Talk, Listen, and Share. So thank you all for joining us tonight for such wonderful information. Just wanted to close with our information here. If you really love Shae's Warriors and what we do, please support us. We are all a volunteer board here to advocate for thrivership and survivorship and in the Coachella Valley and beyond. So if you want, please donate to shaeswarriors.org or on shaeswarriors.org, and follow us on our Instagram at Shae's Warriors Life After Cancer. And thank you so much. Let me talk a little bit about our next Talk, Listen, Share. That will be on November 10th at 5:30 p.m. It is going to be Meditation for Healthful Holidays. So please join us at that time. Thank you so much. Have a great night, everyone.
Bye.
Can't hear you.